One person dies in the United States every 37 seconds from cardiovascular disease. In fact, according to the Center for Disease Control, it is the cause of about 647,000 deaths in the US every year. If that information makes you apprehensive, you need to take a deep breath. In this video you will discover everything you need to know about this disease that claims 1 in every 4 American lives.
Welcome to Simplified Health Tips. Thank you again for checking out another of our videos. I'm Judith. Today Michael and I will explore the symptoms, causes and treatments for cardiovascular disease. So drop a like on the video, hit that subscribe button and let's go. First off, Michael, what is cardiovascular disease?
Cardiovascular disease refers to a number of conditions characterized by blocked or narrowed blood vessels that could lead to chest pain, angina, a heart attack or even a stroke. Also generally referred to as heart disease, it covers a wide range of diseases, including those affecting the blood vessels, problems associated with heart rhythm, and congenital heart defects that people are often born with. However, a majority of heart diseases can be prevented, and sometimes treated, by proper and healthy lifestyle choices.
Interesting. So, what are the symptoms of this condition?
Symptoms of heart disease vary from one heart disease to another. The type of disease affecting your heart will determine the kinds of symptoms you'll experience. These symptoms may also vary according to gender, with women tending to have more symptoms including shortness of breath, extreme fatigue and nausea along with the chest pain or discomfort which they share with their male counterparts.
Okay. So tell us about cardiovascular disease symptoms that are caused by heart defects.
That is a genetic kind of cardiovascular disease where certain noticeable congenital defects are present in the heart. It is common in children and may include symptoms such as infants may experience shortness of breath, especially during feedings which can cause poor weight gain, swelling in the abdomen, legs and around the eyes, and cyanosis, a condition of blue or pale skin. Children who do not experience serious defects do not get diagnosed until in their late childhood or even during adulthood. This is due to the apparent absence of severe side effects. However, underlying symptoms such as constant shortness of breath during physical activity, tiredness, and swelling in the feet, ankles or hands, can be detected early enough. There are other symptoms associated with other types of cardiovascular diseases. The following are some symptoms associated with cardiovascular disease in the blood vessels, also known as atherosclerotic disease. Pain, tightness, pressure and/or discomfort in the chest, a condition known as angina. Pain in the throat, jaw, neck, back or upper abdomen. Also, legs or arms may become weak, numb or cold where there are narrowed blood vessels in those areas of the body. And shortness of breath. A lot of people do not pay attention to these symptoms, and there is a possibility to only be diagnosed with cardiovascular disease when you experience a heart attack, stroke, angina or heart failure. But like most other conditions, early diagnosis is key to managing cardiovascular disease.
What about vascular heart disease? What are the symptoms like?
Remember your elementary biology?
Yes.
Yeah, the 4 valves of the heart, known as mitral, pulmonary, aortic, and tricuspid valves. These valves direct blood flow through the heart by opening and closing repeatedly. When these valves develop any of several conditions, from stenosis to improper closing and even leaking, there are notable symptoms to look out for. Irregular heartbeat, chest pain, shortness of breath, extreme fatigue, swelling of the feet or ankles, and fainting or near fainting episodes. These next set of symptoms are those of cardiovascular disease induced by abnormal heartbeat or what is known as heart arrhythmias. This situation is characterized by irregular, too fast, or too slow heartbeats. The following symptoms are common with the condition: shortness of breath, pain or discomfort in the chest, racing heartbeat or tachycardia, slow heartbeat, which is the direct opposite of tachycardia, and fluttering in the chest. Other symptoms include dizziness, lightheadedness, fainting or near fainting experiences.
Some people have complications due to weak heart muscles. What is that, and what are the symptoms?
That is also known as dilated cardiomyopathy. While it may show no symptoms in its early stages, several symptoms are likely to come up eventually as the situation gets worse. These include extreme fatigue, swelling of areas like the ankles, feet and legs, lightheadedness, dizziness and even fainting, rapid, pounding irregular heartbeats, and occasional difficulty in breathing.
Okay. What symptoms would someone have if their cardiovascular disease were caused by an infection?
There are other symptoms associated with cardiovascular disease occasioned by heart infections, such as endocarditis. This attacks the inner membrane that lay between the heart's chambers and the heart's valves. There are notable symptoms of this disease including fatigue, shortness of breath, swelling in the abdomen or legs, persistent, mostly dry cough, unusual spots or rashes on the skin, and a changed heart rhythm.
If you are having these symptoms, be sure to consult your doctor. As Michael said, early detection can save your life. So Michael, what are the causes of cardiovascular disease? You mentioned a couple just now, but let's dig a little deeper.
Although cardiovascular disease is used to refer to any of the heart conditions mentioned above, it is also primarily used to describe a damage to the heart or your blood vessels caused by fatty plaques building up in your arteries. This is called atherosclerosis. The heart's functions are affected as a result of the continuous interchange and flow of oxygen-rich blood and oxygen-poor blood. When these plaques build up, they thicken and cause an obstruction, disrupting the flow of blood through the arteries to organs in your body. This condition can be caused by mostly unhealthy lifestyle choices such as smoking, being overweight, lack of exercise and unhealthy diet. However, to have a better understanding of the causes of cardiovascular disease, it is important to look at them in the perspective of the various heart conditions that make up cardiovascular disease. Congenital heart defects such as when a baby is still in the womb, and it can be caused by a number of factors including genes passed on to the fetus, inherent medical conditions, and medications taken by the mother that may harm the baby's heart. Cardiomyopathy occurs when the heart muscle thickens or enlarges abnormally. It is oftentimes related to this condition. There are different types and the causes vary according to those types. Dilated cardiomyopathy is caused by often unknown factors. It is characterized by an enlarging of the left ventricle. There are hypothetical claims that point to shortened blood flow to your heart, damage resulting from a heart attack, certain medications, toxins and infections. Restrictive cardiomyopathy has seemingly unknown causes. It is a situation where the heart muscles lose their elasticity and become rigid. There are indications that a good number of cases are caused by diseases such as those brought about by excessive iron pillage in the body, known as hemochromatosis, or protein buildup amyloidosis or tissue disorders. Hypertrophic cardiomyopathy is the abnormal thickening of the heart muscle and it is usually inherited. High blood pressure and aging are other risk factors. Valvular heart disease is a type of cardiovascular disease which can develop in a baby while in the womb. However, damages to the heart's valves can be induced by a number of factors such as infections, connective tissue disorders, and rheumatic fever.
Interesting. Do you have a list of the risk factors for heart disease? I could maybe guess a few off the top of my head, but for the benefit of our subscribers, please elaborate.
There are several risk factors for developing cardiovascular disease. These include family history. A person's risk to have a heart disease is greatly increased by family history where a father or mother, or other relatives develop the disease quite early, usually before ages 55 for men and 65 for women. Aging is perhaps the most common risk factor for cardiovascular disease. With aging comes complications such as narrowed arteries and thickened or weakened heart muscle. High blood pressure is another common risk factor for heart disease. The blood vessels can be narrowed by HBP, restricting blood flow. Gender, believe it or not, men have a higher chance at getting cardiovascular disease. A woman's risk heightens after menopause. Poor diet, certain foods that are high in fat, cholesterol, salt and sugar can greatly contribute to heart disease. Obesity, like for many other diseases, obesity is a risk factor for heart disease as well. Smoking, there's a common medical fact that heart attacks are more likely among smokers than non-smokers. This is because nicotine and carbon monoxide, both from smoking, can make your blood vessels susceptible to atherosclerosis. There are several other risk factors including certain chemotherapy drugs, cancer radiation therapy, diabetes, high blood cholesterol levels, stress, poor hygiene and physical inactivity.
Thank you. Now, please tell us about the complications associated with heart disease.
The most common complications of heart disease are as follows. Heart attack, caused by a disruption of blood flow to the heart, usually by a blood clot. Heart failure, inability of the heart to pump sufficient blood to the rest of the body. Cardiac arrest, a medical emergency caused by arrhythmia. It is the sudden loss of heart function, consciousness and breathing. Stroke, a blockage or narrowing of the arteries that take blood to the brain, leading to very little supply. Other complications include aneurysm and peripheral artery disease.
This one is a very common question from our subscribers. How can we prevent cardiovascular disease?
While there are certain heart diseases that aren't exactly caused by choices or lifestyle, for example, heart defects, there are those that can be prevented by the choices we make. The key is to take away the risk factors already identified from our lives. Exercise regularly, at least 30 minutes every day. Eat less salt and saturated fat. Keep a healthy weight. Quit smoking. Pay attention to health conditions like high blood pressure and diabetes. Practice good hygiene. And reduce stress.
What is the procedure for diagnosing cardiovascular disease?
A diagnosis will usually be performed based on the particular condition the doctor thinks you have. There will be a physical exam and some queries into your family history before any tests are done. Usually, blood tests and chest X-ray carried out to diagnose heart disease can include any of the following. Electrocardiogram, ECG, this checks your heart structure and rhythm and looks out for irregularities. It works with electrical signals. Echocardiogram, pictures of your heart structure and its function are revealed by an ultrasound of your chest. It is non-invasive. Holter monitor, this is more like a portable ECG. It is worn for between 24 and 72 hours to detect heart rhythm irregularities. Other types of tests include stress test, cardiac catheterization, cardiac computerized tomography scan or CT scan, and cardiac resonance imaging MRI.
Importantly, what are the treatment options for someone with heart disease?
There are 3 main treatments for cardiovascular disease depending on the type. These are medications, where an infection is the cause of the heart disease. Drugs like antibiotics will likely be given by your doctor. For other types, there are other medications that will be prescribed by the doctor. Lifestyle changes, most experts say this is the best kind of treatment for most cardiovascular diseases. It is natural and seeks to cause a shake-up to the body without introducing foreign agents. From quitting smoking and low-sodium, low-fat diet, to regular exercising and reduced alcohol intake, there's a lot you can do to treat your heart disease. Surgery, where lifestyle changes and medications have not worked, a specific surgery or medical procedure may be recommended by your doctor. The type is dependent on the type and damage of the heart disease.
You mentioned lifestyle changes just now. Can you expound on that a little more? Maybe list out a few more adjustments we can make to protect ourselves against heart disease.
You can improve your heart health by controlling your blood pressure, quitting smoking, keeping your diabetes in check, exercising regularly, eating healthy foods, such as whole grains, vegetables and fruits, checking your cholesterol, practicing good hygiene, managing stress, maintaining a healthy weight, and dealing with depression.
So there you have it. The best way to prevent or manage a heart condition is by living a healthy lifestyle. Everything you need to do has been outlined in this video. If you have further questions, please leave them in the comments below and we'll get back to you. Thank you, Michael, for the wealth of knowledge you shared with us.
It's my pleasure, Judith.
Thank you for watching to the end of our video. If you found the information helpful, please like the video. Also, don't forget to join the family by subscribing to our channel. See you next time.